Hello, my name is Jennifer, and for the reflective discussion 2, we were supposed to review different material in the module about substance use and then talk about what that looks like in our agencies that we're interning at. So currently, I intern for the Wilmington VA Medical Center. I'm primarily stationed out of the Dover CBOC location. So how the VA addresses substance use and opioid use, and at what system level. I would say it's really on all levels. All staff are trained to assess and assist veterans with getting connected to the appropriate resources. The VA also has some inpatient residential facilities. One of the things about the VA is because it's a federal organization, they have different resources set up in different states. So I know that there's a residential inpatient in Pennsylvania, I believe, called Coatesville, where a lot of times veterans can be referred there for like if they want a detox or something like that. So the VA is really their own entity when it comes to any kind of like substance use and treatment and things like that. Additionally, the VA offers talk therapy with licensed professionals, drug and alcohol abuse counselors. They also have several groups that they run that veterans can be a part of if that's the level of care that they need. They also have people going out in the community to bring awareness and education about the opioid crisis and what can be done, signs to recognize, things like that. The VA also offers a lot of educational supports for the community and for veterans. Like I said, things to be aware of, things have you considered, just so that information is out there, so if somebody needs it, they can try to get connected to the assistance they may need. Additional opportunities for prevention and treatment. Like I said, we do a lot of, the VA does a lot of outreach in the community, and they try to not only outreach with veterans, but other community providers. So it's a pretty close relationship. One experience I saw, we had a veteran who needed some detox services, and because he was a connected veteran with the medical center, that's one of the questions that's asked, and they were able to refer him to the appropriate VA resource to get that assistance he needed. My takeaways from the reading this week, I actually found it interesting. One of the things was about court diversion programs and what they are. And because like I said, I intern for the VA, one of the things is that you get to intern with other social workers from other programs, not just your primary one. So last week I was actually able to intern. It's called Veteran Justice Outreach, and it's a court diversion program. And a lot of times the veterans that come in and are referred, they are actually there for some kind of like substance or alcohol charge. So Friday I got to see some veterans were charged with DUIs, and they enrolled in the program, agreed to the stipulations and the requirements, and they were able to graduate from the program successfully. And what that means is that their charge was dismissed. They weren't charged with like a DUI, so they don't have that on their record. So the most impactful thing this week from the reading and the materials was just that court diversion program, because like I said, I got to experience that in person. So it was pretty inspiring to see, the purpose of the programs and then how social workers are utilized within those programs as well. My comfort level for engaging in conversations with clients, or others about substance use prevention treatment, sometimes it can be difficult, especially if, you're assessing a client and they're disclosing stuff to you, their use, but the client doesn't recognize that they have a problem. So that I feel is always the most difficult part for me, where, as a clinician, a social worker, I may feel like, maybe this is something that we should talk more about, but the client is adamant that it's not a problem for them, even if it may be affecting their life. So that's just an opportunity to continue talking and just educating the client and hopefully, assisting them through that.